Hello, I'm Dr. Johnson. I'm a urogynecologist at Greater Boston Urology. I specialize in women's health, and my practice is focused on urinary function, vaginal health, and maintaining bladder function. What I love about Urogyne is I love that I get to improve a patient's quality of life. I help you achieve the goals that you want and to live the life that you want to live. So overactive bladder is very common. It's a condition that's more common in women than in men, and you tend to develop it as you get older. And so overactive bladder syndrome is composed of 3 symptoms. One is a sudden urge to go to the bathroom, where you'll disrupt a conversation, pull over on the side of the road to go to the bathroom. The second symptom is going often. So it's typical or normal to go to the bathroom every 3 to 4 hours. But if you're noticing that you go every 30 minutes, every hour, then that's too often, and that would be frequency. And the next symptom, or the third kind of symptom, is getting up more than 1 time at night to go to the bathroom. And so that's called nocturia. So I have some patients who get up every 2 hours. That's abnormal. Normal is anywhere from 0 to 1 time at night. I usually start with just behavioral modifications. So decreasing bladder irritants. The biggest one is caffeine. So decreasing the amount of coffee we drink, avoiding things like tea as well. Those irritate your bladder. They make you go to the bathroom more often. They worsen that urgency. Other common bladder irritants include seltzer. So right now, seltzer water actually outsells soda, but it's the carbonation that irritates your body. And then alcohol. I always joke that every coffee house and bar has a bathroom, and it's because coffee and alcohol leads you to go to the bathroom. And so the first step in management is to decrease that. Decrease those irritants, see if your symptoms improve. Next, I say, is pelvic exercises. So actually strengthening your pelvic muscles can help improve your bladder function. You can do that by practicing pelvic exercises at home or going to see someone to assist you, known as a pelvic floor physical therapist. And they will kind of tailor a plan for you to help direct exercises that will help improve your symptoms in particular. This next line of therapy, or second line, is medications. And so there's a whole multitude of bladder medications that work on the bladder muscle to help your bladder function better. The first one is bladder Botox, or the official term is the intradetrusor injection of the medicine, and that just means that what we're doing is we're placing Botox into the bladder muscle. And it's really a muscle spasm causing that urge to go to the bathroom, sending the person to get up and go, and sometimes causing leakage. And so Botox, the way that it works is it helps paralyze muscle. So some patients get Botox in their forehead or in their jawline for headaches. I put it in the bladder to help them improve their bladder function. The second option I talk about is called percutaneous tibial nerve stimulation. And what that is that moves from the bladder muscle itself and starts regulating the signals that the bladder is receiving. So nerves in our body control everything. They control, the rate that we breathe, the rate that our heart beats, but also our bladder function. And if the nerves are sending the wrong signal to the bladder, then the bladder's not going to function well. And so now what this therapy does is it actually activates one of the nerves to the bladder called S3, or the third sacral nerve, and it helps regulate it. And then the third option is called sacral neuromodulation. And what it is, it's an implant, and it works like a pacemaker to the bladder. So the whole device consists of 2 parts. It consists of a wire and a battery. And the wire is what is in contact with the nerve, that third sacral nerve that controls both bladder and bowel function. And the battery is what generates the pulse to allow it to communicate with that nerve. The best thing about sacral neuromodulation is you can try it out before it's placed. So it's one of the only treatments that there's a trial period to see does it work for you. And our goal is to see a 50% reduction in your bladder symptoms. And approximately 72% of patients achieve that goal. And again, these are patients where no other treatment has worked for them. And many of them feel hopeless. And so I get many of happy phone calls because they're significantly improved. And again, they have that freedom to live the life that they want to live.